Okay, Lynn, we're right at 1 o'clock. Are we ready to call the meeting to order?
Looks like we're good. I don't have anybody in the waiting room right now, but we'll let them in if they pop up.
Okay, wonderful. Thank you to everyone for continuing to make this conversation a priority in your schedules. And we're glad that we're able to see everyone today for our June Early Childhood Advisory Council meeting. I'm going to go ahead and call the meeting to order. It's 1 o'clock. And Robin, could you begin with our roll call?
Amy Hood, Amy Smith,
Here.
Andrea Day,
Sorry, Megan, this is Amy Hood. I couldn't find my mute button, but I was waving.
okay, gotcha.
Andrea Day
Thanks.
is here.
Anita Dowd,
Here.
Dr. Annette Bridges, Brittany Howe,
I am here.
Connie White, Danny Carroll, Dee Dee Cummings, Eric Freelander, Dr. Felicia Cummings Smith,
Here.
Greta McKenzie,
I'm here.
Jason Gilbert, Secretary Jamie Link, Joe Barry,
Here.
Kelsey Turley,
Here.
Kim Banta, Paula Goff, Rena Gratz,
Here representing Rena.
Scott Collier, Dr. Thomas Williams,
Here.
Travis Burton, and Twala Burdette. Thank you.
Great. Robin, assuming that we have a quorum, is that?
Yes.
Very good. Thank you. I think we're trying to also work on how to get a closed caption. So just if we could just be patient about that, and we're working on it behind the scenes to do that. Just as a reminder to all members that we have to adhere to the requirements of open meetings. All meetings are recorded, as you saw earlier. Voting members must have their cameras on. However, there's nothing that we'll be voting on in today's meeting, but we still strongly encourage you to have your cameras on. We'll follow, obviously, Robert's Rules of Order. And with that, I am going to go ahead and turn it over to Lynn to go over the agenda with us quickly.
All right. Thank you so much, Felicia. We are going to start with our quarterly updates, and then we have lots of other updates from our partners, as well as some preschool development grant updates and some specific workforce updates. And we're going to hear from a partner that is implementing some of those strategies to just give you guys an inside look at the success of some of those programs. So we can go ahead to the next slide, and I'll just jump right into our quarterly report. We are working diligently. This is our third and final year of the preschool development grant. So we're working very diligently and closely with our partners. We're supporting something called the Pyramid Model Framework, which if you've been in our past meetings, you've heard Dr. Thomas Williams talk about. And we've got some partners here today that are going to go over some of the implementation that's happening in childcare. The pyramid model, we have in the Governor's Office of Early Childhood taken the lead of the Pyramid State Leadership Team. And so through the Preschool Development Grant, we've also been able to expand the implementation, the training and coaching that is a part of that through our child care and Head Start agencies. KDE has implemented for several years now successfully, and so we've been very excited to be a part of making that a standard across all settings. We will hear today from Donna Taylor, our Workforce Director. She'll share more about the Pyramid State Leadership Team. And we'll have one of the state-approved child care training agencies that will share an update about how they're implementing the pyramid model training and coaching. And our Preschool Development Grant Project Director, Crystal Hawkins, will also provide other updates on other strategies that are a part of the Preschool Development Grant. And in the workforce space, the Spring Early Childhood Institute took place May 14th and 15th at the Griffin Gate in Lexington. We had around 300 early care and education providers, and we continued our efforts from our Fall Institute. And so our theme this time was breaking down barriers in early care and education. And the selection and implementation of those sessions was a coordinated effort across all sectors. Once again, we've had some great collaborative and unified partnerships with our early childhood institutes, and those are continuing. We're thrilled to also connect with participants and some vendors that were new to our Early Childhood Institute, including our Family Child Care Network, the Kentucky Special Parent Involvement Network, the Kentucky Career Center and Workforce Services, which we'll hear a little bit about in a moment, some of those strategies that we're implementing, and the Help Me Grow developmental screening, among many others. And we are currently working on the next Early Childhood Institute, which is tentatively scheduled to take place in November, and we will send out more information as that date is solidified. We're also going to hear some other workforce updates, including apprenticeship updates from Ashley Honikin, who is our Apprenticeship Administrative Specialist, and some workforce strategies, including the Talent Pipeline Management System. We're currently also working on planning and scheduling a workforce solutions webinar for the regional collaboratives, and the webinar will tentatively take place in August or September. And that webinar will feature information on workforce support services that are available for early care and education agencies through the Kentucky Career Center. And those are really exciting services that are free to help support recruitment, retainment, administrative burden. We want to lessen that as much as we can. And so those strategies are there for those reasons. And then we will give more information about the webinar. Everyone's invited to attend, not just regional collaboratives, as that date is finalized. And that's all for our quarterly report. And I'll transition now back to Felicia.
Excellent. Thank you, Lynn. We're going to move forward with our partner agency updates. And just as a reminder to this entire membership, one of the things that our goal is to ensure that we are aligning and coordinating and unifying our messaging around the work that is impacting the youngest learners in the Commonwealth. And we need to each be thinking of ways in which we can help make those connections and spread messaging about the great work that has already been underway for many years, but also current work that is happening to advance learner outcomes and readiness for all children and families across the Commonwealth. So please be thinking about, as council members, please be thinking about questions that you might have that arise from our partner agency updates, how you might take this information and share it in your local communities so that we can continue to keep messaging about the great work at hand. Let's start out with Dr. Thomas Williams from the Kentucky Department of Education.
Good afternoon, and thank you so much. So I have two items that I would like to bring to the council today. One item is something that I spoke around, I think I brought maybe a couple of months ago at the beginning of the year. It's around the Helping Children Learn family newsletter. So it's been very well received with our districts. And what we found out is that this company has a summer edition. So what we've done, we have subscribed and we've sent out a summer planners to districts, which will help families, support families with activities for June, July, and August. So again, that newsletter was very well received with districts, and we wanted to continue that initiative. So we wanted to, and so we brought a summer edition to support those families, just to make sure that our children are continue to be engaged throughout the summer. The second item is our Early Childhood Regional Training Center Summer Institute. It's being very well received. This is day 2 of the Summer Institute. We had around approximately over 400 participants to participate with this institute. I actually just left. Very well received. A lot of participants, very engaging. We had activities, not activities, but sessions in regards to DAP, early literacy, pyramid model, and family engagement. So we're very happy that our districts were able to participate with the Regional Summer Institute, and we look to possibly have it again next year.
Great. Are there any questions pertaining to the agency update from the Kentucky Department of Education? Dr. Williams, is there any way that we can get subscribed to the newsletter if we're not already on there? Like maybe if you have our names and we can automatically be subscribed?
I'll look into that. I do know that the subscription was for our state-funded preschool programs, but I'll look to see if I can add this council onto those subscriptions. So I'll keep you updated. Great
That'd be
question.
great. Thank you.
You're welcome.
Any other questions? Okay, great work underway. Let's go to the Cabinet for Health and Family Services, Division of Child Care. Andrea?
Good afternoon, everyone. I will start with, I don't know that this group is aware, but Secretary Eric Friedlander, after over 40 years of service to state government, is retiring. I think that goes into effect officially August 1st. Dr. Stack has been named as his replacement, and I believe is slated to kind of take over daily operations starting July 1. So that it's a big loss for our cabinet because Secretary Friedlander has been here for so long and worked in so many areas within not only health services, but family services as well. But we're very excited to have Dr. Stack taking the helm, and the good work we'll continue to do. So the big things that have been happening in childcare, we had our federal monitoring visit the last week of April, first week of May. Things went well. We are still awaiting our results from that. But as Dr. Cummings-Smith mentioned, collaboration, how do we lift each other up? How do we share messages? That again was a comment made by our review team about all our partners that came to the table, that, just how great the collaboration was, and that they didn't even realize that those partners weren't part of our actual staff, that they were with other divisions. So it's a testament to the work that is supported by our division as well as this body as well. So we're really excited about that. We're anxiously awaiting our results to find out our compliance and things we need to work on. We have had some reg changes that went into effect in the end of February. We have released guidance to our providers through our listserv, and then the Division of Regulated Child Care hosted a town hall yesterday, making themselves available to talk about the reg changes and how those changes would be surveyed moving forward. So really working on community outreach and educating our providers. We did receive some feedback that they want more of that. So hopefully we will be bringing back town halls on a regular cadence moving forward. Another big area that is affects all of us on this call is ECE TRIS. It's during a blackout period right now as we transition from ECE TRIS at EKU to the new Kentucky TRIS. we want to thank our partners at EKU for supporting us through that transition, and making sure that all the data transfers to the new system. It's a lift and shift. And so we look forward to building upon the success we've had with ECE TRIS, modernizing and making it even better. The All-Stars regulation, I know I've been talking about that for years now. Like to prime the wheels before it gets here. But we did a quality survey to all of our regulated providers, asking why they chose to participate in All-Stars, what were barriers to participating, why they choose not to seek higher levels. So we are compiling all that data. And once we have that compiled, we will start having some meetings with stakeholders to talk about what changes are needed, and how we can better support our providers on their path to succeeding to high quality. That's kind of us in a nutshell, just business as usual. And if anybody has any questions, please let me know.
Andrea, you always make a lot of work sound like it's like an easy thing that you're doing. And I had to just make a comment about that because there was a lot in which you shared in that update. One, I think I see Jay Sook, I see your hand. I'm gonna call on you in just a second. I'm wondering if there's anything that you need from this group related to that community outreach. If there's something, once the town halls get identified, if you're moving in that direction, how can we be of support in our areas across the state and sharing that information? Maybe that's one thing. I know I'm chomping at the bit to hear more about the survey data that you all have compiled, and I'm sure many others are. I see a lot of heads nodding. So maybe as soon as that is completed, if maybe we can hear more about that from you, even if it's in between our meetings, that would be really helpful. Let's see, Jay Sook, what would you like to share?
So a comment about I attended the town hall yesterday and I really appreciate that. That was wonderful. And I can see in the chat everybody's favorable reaction too, because it's so helpful to get that, because there's so much to filter through. So I think it's nice to kind of say, here are the changes. This is how you're going to be effective with your licensing when you're surveyed. The question I had was not, it's a little bit broader than just for providers, but talking about the new Kentucky TRIS system. Looking at sort of the workforce with retention and their quality and tracking that. Since we have different settings, is the Kentucky TRIS going to be for all of the different sectors that serve the children, or is it just for childcare specifically?
So that I'm going to be transparent, and probably more so than I need to be. That's kind of a loaded question. So I will say that when I learned of the transition, that was the first thing I said. It's not just our providers. It's Head Start, it's preschool, it's the early childhood mental health specialist, and the list goes on and on. So that has been discussed throughout this process. Right now, we're going to focus on childcare, but the expectation is there that it is bigger than just childcare.
Okay.
So I don't mean to like dodge the question, but
Yeah.
that's our reality right now. And the contract was a huge contract that had been in place 40 years, not only for childcare, but then big TRIS for child protection and our family support. So it's kind of neat in that this transition has really shown a light on how much value that ECE TRIS brings to our sector and how much valuable data we get out of it. And and I always say this, it's not just childcare, because it is so much more. And so I think that has helped reframe the conversation. So I hope that greater things are on the horizon.
That's great, because I was thinking about even from a trainer's perspective too. When we train and we log everything, we put our training, we just want to make sure, because we have different people and they'll say, well, this doesn't apply to me. I need this credentialing and kind of thing. So that's great.
Yeah.
Thank you, Andrea.
Absolutely.
Andrea, there's also another question in the chat. Amy, if you would like to bring your voice in.
Thank you. I just wanted to ask, I know, all of this is really focused on childcare, but I know Tris, as you said, Andrea, is a lot bigger, like with foster care and those sorts of things. Do you know, is it something you can share, like what happened to I know, because I know about, how it was written, it might have been gone to different pieces and different parts for different sectors. Do you have any of that information that's shareable?
Not down in the weeds, kind of information,
you.
but foster care, like I said, foster care, respite, private child caring, child placing, all the different levels of foster care were impacted, as well as family support staff and child welfare staff. So in addition to all those, with ECE TRIS also, we all have concurrent things moving. So there's a lot of hands in the pot. We're trying to make it as seamless as possible, because we don't want to be held in the lurch, if you will, and the work continues. We're going to be recruiting new staff members. We're going to be recruiting new foster parents, and so we can't just stop. So there are things going on, but that's outside my realm. So I've just tried to stay in my lane on that, but I do know that there's a lot going on in that space.
Okay, thank you.
Thank you. Are there any other questions? All right, seeing none, let's keep moving forward. Paula Goff wasn't able to join us today to give us an update on the Part C early intervention work. So let's turn quickly to Kelsey, if you can give us an update on our Head Start collaborative office.
Sure. Thank you, Felicia. Good afternoon, ECAC. I've got a couple of updates to share. If we could move the slide forward, you guys can see some photos from this month. May was a very busy month, not only for the Governor's Office of Early Childhood, but also for myself as the collaboration director. I wanted to highlight Head Start in particular, Audubon Area Services. They are a community action, but they have held a Head Start grant for several years. And they recently opened what they call a learning lab. And so every teacher that starts at Audubon gets 2 weeks in a classroom with an education coach. And that classroom doesn't have students in it, but peers that are also new teachers or assistants starting at the same time. They get 2 full weeks in this learning lab so that they understand curriculum, childcare regulations, Head Start performance standards. They get to model classroom lessons and show routines and schedules and create things for their own classrooms. And that is really unique. They actually were able to set that up based on a community grant that they received from a local bank in Owensboro, Kentucky. And it was really neat to see something that not only Head Start, but just early childhood education in general suffers from is turnover. And so allowing teachers time to have an adjustment period and not enter the classroom immediately is really, really special and unique. And so it was really nice to see that program. So I just wanted to highlight Audubon this ECAC meeting. The Early Childhood Institute was a huge success. I was able to train over 20 Head Start programs on some of the new guidelines for the new performance standards. Those standards have not been changed since 2016, and last year they went through several tweaks that had to do with some big issues. So salary, retention, teacher credentials, safety. And so I really wanted to give the Head Start programs here in Kentucky a chance to ask any questions, clarifications, and network with each other to figure out how they're all going to meet those new standards. And so it was a great session, and it was a great time to collaborate together. Head Start celebrated their 60th birthday this year, which is a huge accomplishment. It is the longest running federal program in the country. We were so excited that Governor Beshear actually made a video and allowed it to be shared with all of the Head Start programs, congratulating them. Carroll County Head Start also created a video, lots of wonderful social media to share all of our youngest learners in Head Start. Then those were also played at the National Head Start Association Convention, which was held in Columbus, Ohio. Again, we had over 20 Head Start programs attend that, represent their agencies, network, and also a few were there to present some of their data. In May, we also had the Apprenticeship Summit, and so we've had our first Head Start join the apprenticeship program, and they have jumped right in with 11 apprentices, which is a huge number for all at once. We are very, very thankful for their participation, and they've also kind of paved the way for other Head Starts. So I'm kind of bouncing around, but LKLP is the Head Start that joined the apprenticeship program, and just a few weeks ago, I was able to visit Hazard with Kayla Jude, who you're going to hear from today, and also the apprenticeship director, Rebecca Smith, in our office. And because of LKLP kind of paving the way for Head Starts with the apprenticeship program, we've had 3 other Head Starts start the process with Kayla to be in communication with how the apprenticeship works, what the benefits are, how it helps with retention, how it helps with that related technical instruction, and how the program really seamlessly blends with Head Start performance standards so that we can support early care and education providers. And so that's really exciting to see that enthusiasm for the program and to watch the program grow within my sector of our office. And then lastly, I was able to visit and train at the Community Action Council Kentucky's annual conference, and they had requested a training on Policy Council, which is a necessary regulatory council for all Head Start programs. They had excellent questions. There was, again, over 15 programs there who were able to network, talk about what works for Policy Council. Policy Council is an essential part of Head Start where you allow community representatives and parents to essentially guide the inner workings of your program. They make policy decisions, they help with parent events and engagement. And so some programs struggle with how to get them worked into their management structure. So it was really nice to hear from programs that have successful policy councils, what they do to get those running every year, and spend some time collaborating as Head Start programs in Kentucky. So again, it's been a really busy couple of months, but really exciting work, and I continue to see the spark for Head Start in Kentucky.
Excellent. And it is so worth celebrating all of the amazing work that's been accomplished with Head Start and with Head Start in Kentucky. And I think that that is really important for us to continue to spread the word about the work that's been happening and the lives that have been changed, trajectories that have been changed because of Head Start.
Absolutely.
I see Dr. Annette Bridges, I see your hand.
Dr. Bridges, I think you're muted still.
Yes, I was. Kelsey, are you at liberty to share some of the significant changes to the Head Start performance standards?
Sure, I'd be happy to.
Okay.
So 2 of the largest ones that programs are having to look at, they do have very long timelines, which we're appreciative to, but salary and pay transparency. So Head Start performance standards with over 50 Head Start performance standards, Head Start programs with over 50 employees now must complete pay transparency studies or survey through their local school districts what salaries local school districts are paying their teachers. So if a Head Start program has employees with comparable credentials, which most do, in Kentucky, we're very fortunate that a lot of our Head Start teachers are credentialed or have bachelor's degrees in IECE. And so they have been charged with making sure that the salaries for Head Start programs are comparative to local school districts. Again, they have until 2031 to do this. So that's giving programs a long time to adjust budgets, find some, hopefully blend some funding, and figure out what works best for their area. Thankfully, a lot of our programs in Kentucky were already there, so it has not been a huge adjustment for them, but nationally, this is something that Head Start programs are going to struggle with. The other was looking at family advocate caseloads. We have found that Head Start programs nationally utilize family service workers in different capacities. Some utilize them strictly for family service work. Some utilize them as family service and health workers. But the Office of Head Start has taken a strict stance that 40 families is an appropriate caseload. So some programs in Kentucky are going to have to look at how large those caseloads are for their family service workers and make adjustments to meet that criteria. Again, Kentucky really stands out, you all, nationally. That's not been a huge issue for us. A lot of our service workers are already under 40 as a caseload, and it's small tweaks for us.
Good. Thank you.
Any other thoughts or comments?
Felicia, this is Amy, and I just want to add to what Kelsey said about another one of the changes, and I'm sorry, Kelsey, if you said this, but I think one of the other big significant changes is the emphasis placed on mental health and some of the requirements toward mental health and mental health supports with Head Start programs. Goes all along with everything else, but I think that that's been, there was a big increase in that as well.
Yes, just as Amy has shared before, some programs were not contracting with mental health specialists that were certified. Again, not a huge issue for Kentucky. A lot of Kentucky programs were already using certified specialists. And so we were able to even network at NHSA conference to show agencies how we do that. But yes, Amy is correct. There's a huge emphasis on making sure that whether a family is in crisis or transition, that there is availability to mental health services specialists, especially for children that require those services and families that need that education. And so the Office of Head Start continues to make sure those partnerships are at the forefront.
Dr. Bridges?
So we know that Head Start is one of the programs who have a strong emphasis on parent involvement and parent engagement. So it sounds like, Amy and Kelsey, that focus on mental health is also going to include the families, which is awesome.
Definitely.
That's exciting. That's exciting.
Yes. Programs are required. I love the performance standards because they make it very clear. They use the word must in a lot of places. And so it makes it clear to programs what you have to do versus giving gray area because that's confusing to programs. And so Amy is correct. That language was changed to must. So not only do you have to have mental health consultants available for classroom support, behavior support for teachers, but you must in your community resource book have community resources available to families in need of those mental health consultations.
And Dr. Bridges, you may remember one of the requirements for a Head Start is to have what we used to refer to as the ECAC, the Health Services Advisory Committee, and they've actually changed that requirement as well to the Health and Mental Health Services Advisory Committee. So yeah, spreading it all around. So very good, very strong.
Excellent. Excellent. Thank you all for the partner agency updates. And, you know, again, the goal for that part of our agenda is always to think about how is all this work being coordinated into a larger system of support for children and families across the Commonwealth. So thank you for the rich discussion, the questions, comments. excellent. We're going to now turn to Crystal Hawkins, who is going to provide a preschool development update, a preschool development grant update for us. So turn it over to you, Crystal.
Thanks, Felicia. Good afternoon, everyone. And it is hard to believe, but we are in year 3, wrapping up of the PDG grant. And so, this is the time of the year with a lot of our guidance. It's really just focused on what do we do as a state to make sure that we are meeting all of the end of year requirements. A lot of the guidance is coming out around just, our final spend down, if there were any changes of scope and, carryover. So these are just customary things that they would always, typically talk about at the end of a grant. And it's, a lot of discussions are pretty customary right now. We did have a town hall discussion yesterday. And again, it was just kind of reiterating those same things, going over closeout and liquidation requirements. And I want to thank Megan Greenwell, who's been following up with our partners just to make sure that within Kentucky, we're good with our contracts and all of our partners, and that we are good to finish out year 3. So that's just where we are. It's hard to believe that we are already here, but that's where we are. I also wanted to just bring note to our external evaluators, which we work with UK, and they are in partnership with KY Stats, but our external evaluators are specifically UK. And so we've been working really closely with our external evaluation team, and they have been looking at just all aspects of our strategies. And with a lot of the guidance with PDG, we know now is a really important time to really capture impact. And so capture impact, things within the grant that are happening, and specifically things within the grant that could not happen without the funding that we're receiving. So we're working with our evaluators to make sure that we capture that. We're looking at a final report that will be presented in next year. However, in the meantime, we have had we did have a parent satisfaction survey and some parent satisfaction focus groups that were presented, and the evaluators will be presenting that to us, I believe, in fall. They will present to ECAC in fall. So that's basically what we're doing. We're continuing to collect our monthly updates from partners, making sure that we can, talk about the impact of this work, and that we can really just, tell a story like Felicia mentioned of, how we're working together, how this is a seamless system, and how really funding is still really important to support some of these important strategies and activities that we've been, working really hard with. So that's my report. Any questions? All right. Well, no questions. I'm going to turn it back over to you, Felicia.
Yep, great. Thank you. And Crystal, thank you for your leadership, over the course of this time. There are a lot of moving parts, and as you know, bringing all of that work together with the rest of the team and the Governor's Office of Early Childhood has allowed us to be able to get to this point around implementation, but also get to a point where we can talk about impact and the accelerant of these resources to help move our state agenda forward. So I really appreciate your leadership in helping to coordinate, align, and ensure that we are meeting the requirements and expectations that we put out in that grant, but also to help us see how it is just moving our state agenda forward. So now we're going to focus on family engagement updates. And Megan, you're going to come into this conversation, give us some updates.
Thank you. So I just wanted to give a quick update around Activity 3 of the Preschool Development Grant, which focuses on family engagement. And so through the work and partnership that we have with National Centers for Families Learning, we have conducted 41 Play with Purpose playgroups and 4 family literacy sites. So we have 41 Play with Purpose playgroups serving over 325 Kentucky families, which is amazing. And we're anticipating 8 additional groups this summer. And as of March of this year, there were 4 PDG funded family literacy groups, them being in Frankfort, Louisville, and 2 in Lawrence and Elliott counties. And we have 55 families currently enrolled. And so family literacy is offered through community-based programs as part of the Kentucky Preschool Development Grant. And it's a 4-component model for multi-generational family programming. And the family literacy programs are designed to be of significant intensity and duration to support families with the greatest needs in achieving their goals. And so National Center for Families Learning provides implementation training and coaching support to each of these partner organizations. And our current programs were oriented to family literacy through on-site implementation training for key program staff. And so on this next slide, I'm going to share with you some survey results that we were able to receive with a Play with Purpose parent survey. And so the report here is showing the results of the parental skills ladder, and it really highlights the growth of the adult's understanding of child development and the role of play. And so parents were able to score themselves in each category that's listed there below for before and after the program, with 0 being the lowest and 6 being the highest. And as you can see, there was growth in each category there, and this is a really positive thing for us to see. And we are really excited about our work that we do with NCFL and all of the families that we're able to serve in the Commonwealth, and that will continue to serve throughout this grant and hopefully far after as well. So thank you. I'm going to pass it back to Felicia.
Great. That's some exciting work that is underway. And, Kentucky communities have really begun to want to engage in new and different ways. If you have any questions, any additional questions about that work, I'm sure if you get it to Megan, she'll make sure that we get it to the appropriate folks at NCFL. And if you know that family literacy would be something that you would like to work with community-based partners to advance in your community, I think we probably still have some means and support that we can make that happen. So, or play groups with Play with Purpose, please just send that information to Megan and she'll make sure that the appropriate folks get it. Next slide. Next, we're going to turn to Donna Taylor, who's going to share a more in-depth review and presentation around the pyramid model for state leadership teams and the national conference updates. So I'm going to turn it over to Donna.
Good afternoon, everyone. Thank you so much. I just wanted to share the pyramid model information about the state leadership team. Alongside Stephanie Ernst from the Kentucky Department of Education, we are the state facilitation team. And so our role is to plan and coordinate all the pyramid model state leadership team meetings, as well as attending the National Training Institute, which I'll share some more information about here in a minute. I wanted to share with you the vision of the Pyramid Model State Leadership Team is that each and every child in Kentucky will have the social and emotional support necessary to nurture and promote the learning and social and emotional development needed for success in school and throughout life. And our mission is to establish a state infrastructure to promote social and emotional competence in infants and young children birth to 5 and their families. This will be accomplished by building social and emotional competencies in children through childhood practitioners, through supporting of a cross-sector state team, promoting evidence-based practices in social emotional development, and developing and providing access to systems for training and resources. So the state leadership team meets the last Monday of each month from 10 to 12, and the first half of our meeting is generally to provide partner updates on the different work that the sectors are doing around pyramid model. And then we spend the last portion of the meeting in work groups, really diving into the work and figuring out how we can develop partnerships and align our efforts. So we currently have 4 work groups working on training and coaching, family and community partnerships, communication, and then our higher education work group, which our really big push is trying to get pyramid model embedded into some of the higher education content, so that people entering the workforce will already have that foundation before they enter the early care and education sector. So if you could advance to the next slide. Our last in-person meeting was held Monday, May 19th. And at this time, we had assigned leads and co-leads for all of our 4 work groups that I was previously talking about. And we started creating action plans to move the work forward. So I wanted to share this visual here. I know it's kind of difficult to read, but at the end of the meeting, we gave each member who was present a note card with the places you'll go from Dr. Seuss. And we asked them to write down one big dream they had for the pyramid model work. So I took a picture and added it here, and it was just so encouraging to see how each one of us has a big goal, but we're still able to align our individual work and come together to create a shared goal of supporting all children across the Commonwealth. So if you could advance to the next slide, I will discuss a little bit about the National Training Institute. Stephanie Ernst with the Kentucky Department of Education, Rebecca Smith, the Apprenticeship Director at the Governor's Office of Early Childhood, and myself attended the NTI on addressing challenging behaviors in Tampa this past April. We were fortunate enough to attend what they call Plan Day, where we had the opportunity to network and learn from all the other states who are implementing pyramid model. So during the conference, we attended various sessions, such as discussing braiding and blending funding to expand pyramid model work. And it's really nice to be able to bring a lot of that information back to the state leadership team. So with that, does anybody have any questions that I can answer about pyramid model work or the conference?
Dr. Bridges.
Yes, and thanks, Donna, for that information. This is really important, especially where we are in not only just the early learning space, but also just school age period. So I guess my question is, what is the age range for this model? You probably
So
said
the pyramid model work that the state leadership team is currently working on is birth to 5.
Okay.
There is also a kindergarten model that we have yet to implement as a statewide approach, but it's something that we're exploring.
And I know that you're getting all of this together to provide for the early learning and development programs. But what is your plan for disseminating this? Because it's just so important to the work that we do.
Yeah. We have been busy working on this for quite some time now. Prior to the Governor's Office of Early Childhood taking over the state facilitation team, it was held with the Kentucky Department of Education. And so and Dr. Thomas Williams, you can feel free to jump in at any time. But I believe for the past 5 years or so, they have been implementing training and coaching throughout public preschool programs. And so having them on the state leadership facilitation team with me and as members is very important, because we're kind of learning along the way in disseminating this to Head Start and to child care programs. And that's actually a great segue. In a minute here, we'll have one of our partners who is doing some of the pyramid model work share how they train and coach.
Okay,
And if I can jump in.
So one more question. So then, Donna, so right now then, is there that connection then? I know that your part is on birth to 5, and then KDE's part, of course, takes up for school age. So are you already beginning, or somebody on your team who's representing elementary, representing school age, I guess?
Currently, there is not. The plan is the state leadership team is discussing how to disseminate the kindergarten pyramid model, but there is not anyone on the team assigned to that. A lot of the work is really heavy in trying to figure out how we're going to provide coaching and training models in a systematic approach.
Well, I appreciate the work that you all are doing on this, and I just want to emphasize that the alignment birth through is so important, and I just wish that that work could happen from the very beginning, because I'm just saying, I believe in early childhood, we do awesome things. And then what happens is when these children go from quality early learning programs that support and implement this pyramid model, when they get into school, it's totally different for our young children. So anyway, but thanks for your work.
Absolutely. Thank you.
Jay Sook, and then Dr. Williams.
I thought Dr. Williams was going to make a comment about the pyramid model first, so maybe I should have him go before I ask my question.
That sounds great. Thank you, Dr. Gilbert. Dr.
So
Williams.
thank you so much. Yeah, hey, so I just wanted to just piggyback off of Donna. Donna, you did a great job in regards to how we have aligned the pyramid work. So at the Kentucky Department of Education, we started this work around 2018, 2019. So we've been doing it quite some time now. We've implemented started the state leadership team. That was around 22, maybe 23, where we've partnered with the Governor's Office of Early Childhood. We've done a phenomenal job. We have our pyramid specialists who sit on that pyramid team, and also our 619 coordinator who also sits on the team to make sure that we have that preschool special education voice on the team. We have our regional training centers who work very closely with our districts to support them with the pyramid work. So again, it has been a phenomenal initiative, a phenomenal framework that has really helped our districts support those preschool students with their social and emotional development. So just wanted to just piggyback off of Donna in regards to how we're continuing this work and elevating the work across the state. And we are looking at, we are aware of that kindergarten pyramid. And so internally, we're kind of talking about that and how that may possibly look. But that is currently a conversation internally and how we can explore that opportunity.
Excellent. Thank you. Dr. Gilbert.
Thank you. My question was, this is pyramid model training, and the hope is to get it in childcare and all different sectors. Just so important for the challenging behaviors and socio-emotional and just approaches learning and so on. And I know, Dr. Williams, in state-funded preschools, you use Teapot to kind of assess and evaluate how the teachers are, doing this, right? Whether it's the fidelity or it's really helping them to be able to do it, rather than here are certain pieces of training and then you don't know how much it's being implemented or how well in different classrooms. So my question is, in terms of that big picture then, is there a plan going forward or in next steps or down the road? Is Teapot going to be a part of for the non-state funded preschool system as well? Or how is that a part of the discussion or conversation for the leadership team?
Well, Dr. Gilbert, I can tell you that that is in conversation in the state leadership team. There's a lot of moving parts with that, and a lot of people involved in that process of how to make that work and how to add that. So, but yes, that is something that we have a conversation about. And I really don't know more to share with you than that. I see Andrea has her hand raised, so maybe she can add to that better than I can.
Well, thanks, Donna. So I have asked my All-Star staff to start working on a crosswalk between Teapot and the Eckers and all the ERS because right now, childcare, we're not moving from what we're currently doing, but at the same time, when we have programs that are public pre-K or Head Start and also a licensed childcare facility, that could be cumbersome to say the least. So no promises, but we are looking at that. And like I said, I've asked them to create a crosswalk for us to compare so that moving forward that we can have some intentional conversations around that, because obviously we want to support our providers and not add administrative burden. So that's a work in progress. And I also wanted to touch just for a moment, Dr. Bridges, you had asked about, out of school time and school age. I will say that CIOSA, the Kentucky Out of School Alliance, are very active. They have started a school age advisory council to kind of unify the out of school time space for those school age children. So they are much more visible than they have been in years past. And they are always at the table. They are part of the Child Care Advisory Council. And I know Lynn has involved them in the joint standards work and the career lattice and things like that, so that we don't lose sight, because we know that over 43% of our kids access out of school time care in some way. So while each group has a different age group to focus on, whether it's 0 to 5, 0 to 8, or whatever, we're trying to make sure that they have a seat at the table as well.
Yeah, and I was trying to find my hand raise button. My Zoom looks totally different, so I'm like hunting and pecking for it. But I just wanted to jump in and reiterate the things that Andrea shared and Donna shared, as well as our real intention behind this whole strategy and getting involved, and from the state leadership team all the way to the coaching and training that we're offering for childcare and Head Start. We wanted to make sure we were aligning that quality across the board. And KDE had done a fabulous job of really showing the success of the pyramid model framework. And so we wanted to make sure that we were supporting that alignment across childcare, Head Start, public preschool, so that that quality was in place for behavior supports and social emotional development. So this has been a great opportunity for us to really unify and pull all of the different sectors together around a specific strategy that really benefits the children in any and every of these environments. So I just kind of wanted to jump in and say that.
Excellent. Thank you. Thank you, Lynn, for bringing it all back to the systemic movement that is underway and creating a coordinated and aligned and unified approach. That is what this body is responsible for, refining and communicating outward to our colleagues in the field. So I also saw Jae-Suk, I'm just going to read your comment. This is really exciting. Love to hear about the different sectors working together for systemic change. And that is exactly what we want to echo in our own corners across the state with our colleagues. So excellent job. Anything else? Donna, were you going to introduce us to someone else as well?
Absolutely, yes. Thank you so much. So continuing our discussion with pyramid model work, I wanted to bring somebody, one of our partners, to spotlight the work that they are doing. The Governor's Office of Early Childhood has partnered with 7 training agencies across the state, and they are tasked with going out and training child care centers on the pyramid model and coaching them through that work. And so I'm really excited to have Stephanie Goebel with us today to share the work that is going on with 4C. So I will pass it over to you, Stephanie, and we can transition slides.
Thank you, Donna. Hi, everyone. My name is Stephanie Goebel, as Donna said, and I am the Director of Early Childhood Services at Community Coordinated Childcare. And I'm really excited to be here with you all today to share a little bit about how my agency works in partnership with GOEC to offer training and coaching on the pyramid model for childcare educators in the state. So we have partnered with several centers to offer on-site training, as well as offered community-wide training for childcare centers to come in sort of a cohort model. Our trainings are all followed up with practice-based coaching, so the educators receive individualized support in implementing what they learned in the trainings. They will set goals with the coach, have follow-ups, they'll have observations and feedback, and then they'll start over and either rewrite the goal or move on to something new. And what we've noticed is that there's a lot of training associated with the pyramid model. Infants and toddlers, for example, those educators receive 21 hours of training, and preschool staff receive 34 hours of training. And schedules and staffing, that has been a little bit of a barrier for us, but we've done a pretty great job of making it work. And in particular, we have one center who really is able to once a month, they're closing down early to be able to allow for staff to have and receive this training. So they're getting it once a month, and we do these trainings in 3-hour increments. And the image that you see on the screen, I'll follow up with that, but this is related to that center in particular. So what we can say about this project is the coaching piece of this has made all of the difference. When educators receive both training and coaching, we really see a big improvement in the retention of knowledge as well as the implementation of the pyramid model in their classrooms. A couple of successes that we wanted to share. Our coaches have provided all of our classrooms with feelings charts, and they have the problem-solving cards in the classroom that go along with the pyramid model. And not only are these in the classrooms, but they're being used every single day by the educators. And staff are explicitly teaching friendship skills to children. And we have seen behavior incidents at these centers go down in classrooms where they are implementing the pyramid model routinely. We have seen several children who we have heard are on their last strike be able to remain within the program because of the work that the educators are doing with the training that they've received. And to refer back to this image here, due to some private funding that 4C has, we added the teapot, which you all talked about a little bit a few minutes ago, to pre and post for the center that is able to really close down once a month to provide the training. And what you see here is from the fall of 2024 to recently, within the last several months, the growth that the classrooms have had because of the partnership with GOEC to be able to provide these trainings. So even classrooms who were at 80% showed growth. So everyone from the 40% all the way to the 80% showed significant growth. And we're just really proud of that. And I'm happy to be able to highlight that for all of you today.
Dr. Bridges.
Yes, and thank you so much for that information. I have a question about the training model and what all it includes, Stephanie. And in particular, do you address ACEs, the adverse early childhood experiences, and the impact on social emotional development?
Absolutely.
Okay,
ACEs
good.
is a big part of the introduction to the pyramid model, and we spend a lot of time focusing on that.
Great.
Are there any other questions? Lynn, I think you maybe had some comments. Okay.
Yeah, sorry, I'm muted. I've unmuted and then muted. I just wanted to jump in and say one of the connections to our work in the preschool development grant and the goals of that grant with this program is to decrease the number of expulsions. And so these numbers, I think, show a great picture of that. We know it's best practice not to expel or remove a child from an early childhood setting, specifically due to behavioral issues. And so this tool in particular really gives all of the early care and education providers hands-on coaching that helps with that implementation and is really working to lessen those expulsion numbers. And so we're really excited to see what the data tells us. This is a snapshot of some data, but we're really excited to see what the data shows us overall after the implementation is complete. So just wanted to jump in and give that little toot of the horn.
Excellent. I'm glad you did that. One of the questions that I have is, this is one way in which we're sharing the positive things that are going on because of this work coming out of the Department of Education. Dr. Williams, I'm also wondering, like, in what other ways has the department been able to lift up some of these promising practices? And I know that the Pritchard Committee is also responsible for lifting up promising practices across the state in certain ways. And so I just wonder, Dr. Thomas Williams, how is the department really speaking beyond just the echo chamber of people who really care about this, but like getting the word out broadly that this is what's happening in partnership maybe with the Governor's Office of Early Childhood?
Yeah, that's a great question. So we are, and I'm speaking to my team also, trying to see how we can begin to lift this work outside of our ecosystem. And so we are, we sit on committees within the department with social and emotional committees throughout the agency to kind of talk around what we're doing in preschool to build that component. And we're also looking at trainings outside of early childhood, like other national trainings, state trainings. To make those aware of the pyramid model and what we're doing in Kentucky.
Excellent. Excellent. Is there anyone else that wanted to add? Okay. Seeing nothing else, Donna, were you going to also turn it over to another colleague? Great.
Yes. Thank you so much, Stephanie, for that wonderful update. Appreciate your time and you being here with us today. Next, I'd like to welcome Ashley Honikin. She's the apprenticeship administrative specialist, and she's going to give us some updates on the apprenticeship program.
Thank you, Donna. So I'm excited to share some updates about the Registered Apprenticeship Program, including current progress and upcoming plans. So right now we have 85 graduates and we have 142 active apprentices across cohorts 3, 4, and 5. And we have 61 employer partner sites throughout the state of Kentucky. So that's exciting. And we are currently recruiting for cohort 6, which is set to launch in September. And we actually have officially launched our Blackboard site. So right now, our registered apprenticeship participants, they are able to access their program-related content within our Blackboard and be able to submit for WEMA, which is their Wage Increase and Milestone Achievement Awards. We have contracted with Kentucky Credentialed Trainers, so they are building on-demand content which aligns with our apprenticeships, with our apprentices' occupation-specific pathways. So we're being very intentional with our content trainings. And we've hosted 2 summits this year. So we had our Mentor and Employer Summit March the 24th and the 25th. So at that summit, we had over 70 participants who were mentors or employer partners. So they gathered for 2 days and they received role-specific trainings that aligned with the apprenticeship program. Just this month, we hosted our 2nd annual apprenticeship summit, and at this summit, we had over 90 participants, and they gathered for 2 days and they received RTI-specific training while they were there. And those are my final updates on the Registered Apprenticeship Program. And I am really excited about the launch of Cohort 6. We are going to be implementing new processes for our onboarding protocols, and we will be able to house all of our related technical instruction on our Blackboard site.
Thank you so much, Ashley. Are there any questions about the apprenticeship updates or for Ashley? Wonderful. Well, I will go ahead and, oh, I see a hand. Yes, Andrea.
I just want to say job well done, because I know this has been a huge labor of love. And from it rolling out several years ago to the consistency and the momentum that is behind this program, I just wanted to give you guys a shout out because it is phenomenal.
Thank you, Andrea.
All right, so we will go ahead and transition to some workforce updates. I'm excited today to introduce to you Kayla Jude she is the Apprenticeship Workforce Consultant for the Office of Employer and Apprenticeship Services.
Perfect. Thank you so much. I'm so excited to be here. I know there's a lot of text on the screen right now to tell you a little bit about that talent pipeline management model that we are implementing. So like Donna said, my name's Kayla Jude. We're actually going through a name change. I just got the official word yesterday that it has been approved, and our office will be called the Office of Industry and Apprenticeship Services. And my industry is early childhood education and care. And I will tell you guys right now, for the past 2 years, I've been working with the Governor's Office of Early Childhood, advancing their workforce initiatives. And I'm here to tell you, you guys are well beyond other industries and trying to figure out your solutions for your workforce pain points. One of the things that I have been assisting the Governor's Office of Early Childhood with is what's called a talent pipeline management model. So I help out Ashley and Rebecca with the apprenticeship program a lot. I do a lot of training with the apprenticeship program. And I always talk about how registered apprenticeship is an employer-driven education and training model. The talent pipeline management model is an employer-driven recruitment and retention strategy. And it's employer-driven because us as workforce professionals are really getting down to the nitty-gritty with your industry professionals and figuring out, hey, what are your workforce solutions? And instead of us just getting all together and complaining about it and nothing ever changing, we're actually going to talk about it and say, how can we change it? What can we do to change our problems and make them solutions? So why TPM for early childhood? It's to ensure that our early childhood sector has reliable, skilled workforce. It aligns talent development with employer demand. Essentially what happens is we have a team, and it's led right now with Donna, myself, and folks with the Kentucky Chamber Foundation. And we were talking across all three of your sectors, our public pre-Ks, our child care centers, and our Head Starts. We've talked to them as a group to start out to kind of feel out, you know, what are we thinking? What are our feelings? What are our thoughts? And then what we're doing is we're dividing into those actual industries to talk about pain points and solutions. And that's where we're at with talent pipeline management right now. We're in those beginning phases where we are actually sending out surveys to get those deep dive sessions for those three industries. I'm actually going to pop my email and Donna's email in the chat. So if you guys are interested in learning more about Talent Pipeline and learning more about how you can be involved, please email us. But essentially what's going to happen, our next steps is we're going to take those three industries and we're going to talk about those problems and then talk more about solutions. We're going to use the data that our employers are actually bringing to the table. We're going to analyze that data, whether that be something like a job description, whether that be something like these are the credentials that we're offering, and we're going to compare them statewide and see what gaps are there or what solutions are available. I want to pivot a tiny bit to talk about the SWOT method as well, because talent pipeline management is essentially an arm of a new initiative, a new workforce initiative that's been backed by Governor Beshear called SWOT. And that stands for Statewide Workforce and Talent Team. And what it really provides is regional collaboration to employers so they can get the solutions that are regionally based. Usually it starts out with some type of needs assessment. Again, that kind of goes with that talent pipeline management. And if you'll see there, it says that connector role. Guess what? I am your connector role. So I will be your all single point of contact for workforce services in the industry. So just because I'm a statewide consultant, what that means is I'll be able to connect you on a regional level to people that can assist you with your workforce challenges. So again, we had that initial meeting May 23rd. The next step, we had 46 individuals that signed up for those deep dive groups. Each group will examine sector-specific workforce challenges and trends. The Kentucky Chamber Foundation is gathering data, tools, and support for this first deep dive session. We're thinking around August, September for that first deep dive, and we're very excited. Those are my updates. I'm going to send it back to Donna. Please let me know if you have any questions. Thank you so much.
Thank you so much, Kayla. Does anybody have any questions about TPM or SWAT?
Kayla, as soon as you get the dates for those deep dive sessions, it would be great if you can make sure that Lynn has them. She can share them out with this group. This is really exciting work.
Absolutely. I'm very excited too.
Wonderful. Thank you so much for being here, Kayla. We appreciate your time and sharing all that information. And now I will give an update on another workforce update on the Joint Standards Committee progress. Sorry. So the work is moving very quickly, and the Joint Standards Committee is working on 2 initiatives simultaneously. So we've already completed the joint standards, and now we're diligently working on redesigning that career pathway, which was previously called the Kentucky Career Lattice. So that may be how you're familiar with it. We have a draft version that is currently with a focus group for feedback, and that will be taken back to the committee for the redesign so we can finalize our draft. And we're also working to secure a contract with Tyler Technologies. And I kind of discussed it at the last council meeting about how we're going to make the career pathway interactive, and it will be housed on the Governor's Office of Early Childhood's website. And so the hope is that those who work in early care and education and providers are able to navigate that system very seamlessly to understand how they can move through the pathway and where to access different opportunities like the apprenticeship program or different things like that. So we're hopeful that we'll have the interactive platform up and running and able to share with you at the September meeting, pending that we get our contract and start moving forward with that work. And at that time, too, we would also like to provide training and technical assistance to providers at our November Early Childhood Institute. So be on the lookout for that information, and we'll share more as we know more. Simultaneously, the Joint Standards Committee is working on updating the Kentucky Early Childhood Professional Development Framework. This was last updated in 2011. And so we're really excited to have a lot of people at the table, including some people that worked on the update in 2011 to revise that. So their feedback's really invaluable. And again, we're hoping to house this on GOEC's website and make it interactive as well. So we also plan to complete this and have it to share with you at the December council meeting. So be on the lookout for that as well. Does anybody have any questions regarding the work of the Joint Standards Committee?
Dr. Bridges.
Donna, will the changes to the career lattice require any changes to the Kentucky All-Star standards?
Most likely.
Okay.
And I'll jump in. Andrea had to jump out. I think she would speak to this, but they're currently looking at the All-Stars and they're part of this work as well. So making sure that there's alignment is part of the process.
Okay, thank you.
All right, any other comments or questions? Seeing none, then we will go ahead and share with you, just as a reminder, our upcoming dates for our next few meetings. September 18th will be from 1 to 3 o'clock Eastern Time, December 18th from 1 to 3 o'clock as well. And I know there's one more slide for us. Again, we want to say thank you for your commitment in showing up, contributing, taking this information back to your community. If you have any questions or thoughts or concerns that might come to mind following today's meeting, please don't hesitate to reach out to Lynn and team, because I know they want to hear your feedback so that we can continue to improve our efforts together to unify the work across the state. And then there's one other piece. I know that many of you have been noticing on the news the conversations around pre-K for all. I would strongly encourage you to visit the website. I think Lynn's going to place that thank you into the chat. Please go there, visit the site, look for updates, get involved, get engaged. This is an ongoing conversation, one that has been in the making for many of you across your careers, on how we can continue to improve early learning and care for our youngest children across the Commonwealth and their families. So please be sure to visit that website, get familiar with it, sign up for news updates, etc. We'll need all of us pushing in the same direction and rowing in the same direction as we move forward. So thank you again. Lynn, I'll leave you with the last word if there's anything else you'd like to share.
Yeah, I just would like to thank you all. We know we threw a lot of information at you in a brief amount of time, and we love the engagement that we've had today, and always welcome your feedback and engagement in those conversations. So thank you, and thank you, Dr. Cummings-Smith, for leading us onward.
I'll need a motion to adjourn.
I move that we adjourn.
Thank you, Annette. Is there a second?
I'll second.
Second, this is Amy.
Amy, thank you so much. All right. Have a great rest of your afternoon. And we will see you soon. Thank you so much.
Thank you all.
Thank you.